right. Thank you very much for keeping it TV47 and of course Body Garage on this episode where we are delving into cancer screening and management. And Daktari, before the break we had just touched on what cancer screening entails. Yes. You've rightly put it that it doesn't take so much time. Within minutes I'd get my results. Yes. Now my question would be, what next? What should I expect now after getting my results? If it is a positive test results, what does that mean for me? Okay.
Thank you so much. And allow me to just take a minute to be a bit more specific on the screening tests for the 3 types of cancers which we are currently dealing with as a country. So for breast cancer, it's one of the leading cancers among females within Kenya. So the most common test that we do is what we call a breast mammogram. Yes. Or in some facilities which don't have the X-ray machines or the ultrasound, we can also do a breast exam, the physical breast exam. It is also considered as accurate enough in trying to screen for breast cancer. So I just want to mention the specific test so that a client coming or one of our viewers is able to understand, in case I want to be tested for breast cancer, what exactly will be done or which test I need to go for. Then for the cervical cancer, the second leading cancer among females, for cervical cancer it's actually much more easier. We have something called a pap smear. Nowadays we even have one which you can be able to test by yourself. So at home, but it's always good to come to the health facility. Then we can be able to do a pap smear where we just get a small sample from the cervix. That is the mucosal lining within the cervix of a female reproductive tract. And then we can also be able to check for the HPV virus within the blood. So we have 2 tests. So we can do the pap smear at the cervix, and also we can be able to do a blood test to check for the HPV vaccine. Then for the prostate cancer, some years back, this used to be a very big issue and brought a lot of stigma around screening for prostate cancer because there used to be a test we used to do called the digital rectal exam, which made males, most of the old ones, to totally never like coming to a hospital because that procedure was not very friendly for them. But nowadays we can be able to do just a blood test to check for just a small antigen which we check in the blood, and you can be able to tell us if this male either is in the early stages or they already have prostate cancer. For colorectal cancer, which is the 4th, we just do an endoscopy, which is also just a small camera that we put through the mouth, down into the stomach and also into the intestine. And also we can also do colonoscopy. We just insert a camera through the rectum, which can be able to view the inner lining of your large intestine. So having said that, so those are the tests that we do to screen for different types of cancers. So when you walk into any health facility and probably you want to do a screening test for a certain type of cancer, probably because, as you have mentioned, you either have a family history or you have heard that you fall under one of the risk factors that you have mentioned, and we do those tests. Out of all the tests that I have said, none of them will take more than a day. So you walk into the health facility probably for a pap smear in some lower health facilities. So they will tell you to come for results probably after 2 or 3 days, but never to be admitted in the hospital. So once you get your results, now there are 2 potential outcomes. So one, your results may actually be negative. Negative in the sense that you don't have any cancer cells that are growing within your body. So definitely that will be the good news to each and every person.
Of course.
And what that would mean is that now you'll also be educated in most of these health facilities, given very specific health education on how you need to have a proper lifestyle so as to prevent yourself from getting cancer in the future. Because that doesn't mean if I'm screened today and the tests are negative, it doesn't mean that I'll not have cancer for the rest of my life. It's good for all of us to remember that cancer is more or less a non-communicable disease and a lifestyle disease. So lifestyle diseases develop over a long period of time. So, and some of the tests, we have to admit, some of the screening tests that we do are not very specific. So meaning they may not be able to detect cancer at that very time when you go for the screening test. But probably an year or 2 years after, then you may get, you know, now a positive test result. So it's always good, you know, once you get your results and they are negative, you know, that is what everybody would want. But that means now you need to take measures, appropriate measures to avoid you from getting cancer in the future.
In the future.
Now, the other potential outcome is that you can have, you know, your test being positive. Now, positive means you have cancer. And cancer, we normally stage cancer, you know, differently. For instance, you may be told, you know, you are in cancer stage 1, stage 2, stage 3, stage 4. Most cancers, we stage them into those 4 different levels. Now, it is totally impossible for someone to walk in, because with screening, we're imagining this is someone who is healthy.
Yes.
Because when I go for screening, I'm healthy, it's only that I don't know whether there is any cancer in my body. So that would mainly be cancer stage 1 and stage 2, that you might be tested and is detected that you have the cancer in the early stages.
As you say that, Daktari,
yes.
Does it mean then that those results, you said that you can detect either stage 1 and 2.
Yes.
Does it mean then that result is a diagnosis already?
Very true. Actually, with cancer, for instance, if I take an example with a mammogram, if I do a mammogram because it's an X-ray that is able to view the breast tissue, at the point of screening, the goodness with screening, it can also be a good diagnostic test to confirm for you, you have cancer, and this cancer is at this particular stage. So, but there are those which are a bit not very specific. For example, the PSA for prostate cancer, the blood test, it can only tell us this individual has cancer, but we need to do some further tests for us to confirm which stage is the cancer, because staging of cancer is very important, because it's the one that will direct us into what modalities will we use to treat and manage this patient who has the cancer. Yes, so when the test is positive, now it can also be a point where this patient, if I may call them so, because now they have the disease, we are able to know which stage of cancer they are in, so that you can be able to decide, you know, how to start the journey of management of cancer.
Yes. And for people who normally live in denial, or maybe those results would be shocking when they see a positive test result, is there a likelihood, or let me phrase it as this, how accurate are these results, you know, oftentimes?
Okay. That's a very good question, because as you have said, I think there is so much stigma around cancer, and probably it's one of the reasons as to why most people would rather not come for screening. They would say, I better know when I already have the disease.
Yeah, precisely. Yes,
rather than have the bad news when the cancer is at the early stages. But actually it's the other way around. You know, for us who see these cancer patients on a day-to-day basis, I would actually, you know, advise people, it's way, way better for you to detect and to know you have cancer at an early stage. For the one and very reason that once cancer is detected early, you see all those 4 cancers I've mentioned,
yes,
and probably you are at stage 1, and then we start the management and treatment at that very time. Trust you me, you can be able to have full 100% recovery from your cancer. Because the thing with cancer is, by the time you start getting the signs and symptoms, and you have physically, you now start appearing you have the cancer, which is mainly a stage 3 and stage 4, then the chances, not that you can't fully recover, but the chances are way less compared to if cancer was detected early. And I think, you know, people are getting more knowledge about cancer, and they are embracing it, and we have very many cancer survivors out there. So therefore, people shouldn't fear, you know, screening and knowing whether they have cancer
or not.
Because once you know that you have cancer, you know, we normally have, you know, the team that is normally involved in management of a cancer patient is not just the oncologist. That is the doctor who is, you know, targeting and managing these cancer cells. We also have a nutritionist on board. We also have a psychologist on board, so that we are able to manage this patient holistically, so that we can be able to cater for all their needs. So let people not fear that they have it, but we always see patients who are in denial. So they're told, especially men, for some reason, you know, you'll tell a patient, now we have confirmed you have prostate cancer. Definitely, you know, some of them, because at the point of screening, you look healthy and you're okay.
Yes.
So you'll actually start doubting whether for sure you have cancer. So, but as you said, it's always good. And even as a hospital or as clinicians, we always want to do another test.
Okay.
So at the screening point, that is just an indicator you have the cancer, but you'd always do another test just to confirm for sure whether this is cancer. And mind you, we need to get this right. When I do a mammogram on a patient and identify there is a growth, now the only confirmatory test to tell me that for sure this is cancer, we have to do a biopsy. So we have to take a small sample of that tumor or that growth, take it to the lab, then a pathologist will be able to look into those cells and now identify that for sure these are cancer cells.
Okay.
So a simple test will still not be confirmatory as good as it is. We still need those lab results from a pathologist.
Okay.
Yes.
All right, Daktari, we are up for our second commercial break. We have just learned so much on this screening. Now, when we will be back after the break, we will now talk about the management bit of it. Do not go too far. Keep it TV 47.